Welcome to our program on Kardec Radio.
Hello, everybody. It's a pleasure to have you here with us today. It's 7:15 in Ireland. We have a sunny Ireland. And now we have a special guest, Dr. Sergio Thiesen, for the second time talking to us. Who doesn't know, Dr. Sergio is he's a physicist and a physician as well, physics and physician. And he literally worked to spread the Spiritism around the world, over 34 countries, spreading the Spiritism in different languages, get to know what is the reality outside of different cultures, different countries, and he is here all to help us with his knowledge as a doctor and his knowledge as a physics person as well. So, Dr. Sergio, welcome. Thank you very much for your availability. And today, as usual, we will have Dr. Sergio giving his talk about 45, 50 minutes, and then we will open to questions and answers. If there are any questions unanswered, I will send this to Dr. Sergio, and he will reply, and we put this on the comment box in the post. So feel free to answer your questions, and we won't be without any answer. So I'd like to welcome our brothers and sisters from America. I know it's good afternoon for you guys. Thank you, our dear friend from Chicago, Donson Ball, our Spiritist workers here in Ireland, Camila, Daniela, and friends from Brazil, friends from Italy. I have seen from Italy. We do have friends from Spain today. Yeah, so thank you very much. And thank you who are listening Kardec Radio through your car or through the internet. Our warmest greetings from Ireland. So in order to start, I would like to do the initial prayer. And I'd like to invite everyone, if you want, if you can, to close your eyes, raise up your thoughts towards Jesus, towards our mentors, ask them to stay with us, giving us the opportunity to grow spirituality, giving us wisdom to make the right choices and use our free will as it should be. At the same time, we ask for the spirits who protects SSI to stay with Dr. Sergio today and allow him to reach many hearts now live and during this, when someone will reach and face this on YouTube or Facebook and read and listen to this. So thank you very much. So be it. Amen. Okay, Dr. Sergio, once again, thank you very much. And it's nice to have you here today with us. Our topic today is depression and suicide. It's a very important topic, especially because now in September we join efforts in order to work with the suicide prevention community. And this is a great opportunity to have you here to give your knowledge and share your knowledge and thoughts about it.
Thank you, Stephen. My pleasure.
Okay.
Well, how are you, my friends? Hi, everybody. I am living in Rio de Janeiro. I am in Rio now. And we'll have something like an hour to talk and to study about depression and suicide. As a doctor, we need to study and understand this very important problem in terms of humanity, a medical problem, because in all over the world we have a big statistic in terms of depression as a public health endemic problem, and as consequence of depression, very frequently the problem of suicide. This is a very significant problem in this world, in our humanity. So I would like to share with you some aspect, and so I use the PowerPoint to have some kind of a guide, because we have only 1 hour. This is an issue for one seminar, but let's go, Stephen, please.
Okay, so my friend, I'll be here on the backstage. Okay.
Thank you, my friend. The next. This is one epidemic in terms of mental illnesses, in terms of general psychiatry problems. So, by the World Health Organization, we have 500 million of people as patients in terms of mental problems, of mental diseases. So we understand that we have more than this, because many cases that people don't know about the signs and symptoms of the different psychiatry diagnoses and syndromes. But on Earth, we have one idea of 7.5 billions of people. So we have a very important number of people suffering of mental health problems. So we have one idea from the World Health Organization, 1 in each 4 will have mental disease in some time of their lives. This is one kind of prospective idea to this future, to the near future, in terms of some decades from now. The other big problem, very clearly related to depression, that is the suicide. 1 suicide case in each 40 seconds in the world today. This is a very big and suffering problem to the people that commit suicide, his or her family, and the society and economics. We have many different consequences, all of them very bad for our humanity, including in terms of spirituality, because all the people that are suffering in this world will suffering more in the spiritual realm, in the spiritual world. So we are dealing now with a very important aspect of this humanity. And as spiritists, working or not in the spiritist society, we need to be informed, we need to care, we need to stay open to hear our brothers and sisters in each one of the scenario of our life to help our brothers and sisters affected by this tendency in terms of mental problem. Let's go. Stephen? One before. What is unipolar major depression? This is the main depression syndrome. Unipolar major depression is a mental disorder, it's a disease characterized by pervasive and persistent low mood that is accompanied by low self-esteem and by a loss of interest, of pleasure in enjoyable activities. We can talk about the main manifestations because we have many, but affects daily life for weeks or longer, interferes with social life in terms of family and relationship, work and school life, sleeping and eating habits, and implications of general health. For example, one people that is affected by depression, for example, we have diabetes in the humanity. This is another epidemic. We have hypertension, we have cancer. And all the people that have one medical, clinical problem, but they have also depression, they do not care him or herself. So the other problems in health will have one bad medical prognosis and evolution because of the difficulty to care of the medical different problems. So we are dealing with a very important disease with so many different consequences. I will tell you about one aspect of a new paradigm in medicine. For example, if I have two groups in my job in the coronary heart intensive care unit, when I study the consequences of depression, comparing two different groups of the same acute myocardial infarction patients in the coronary care unit during, for example, 5 years, and I compare two groups with 200 patients, each one, in the final consideration of the medical study, I can observe the double of the mortality of the cases with the same coronary problem, but with depression. The people with depression will have a double, statistically, mortality in the hospital time of, for example, 1 month. So we don't know exactly why, but we consider the problems relating mental condition and the heart of the people. Why depression and how depression can can get a consequence with the double of the lethality or mortality. This is a very incredible consequence. Here, the idea of two kinds of depression, but the main one is the unipolar, only depression, but in different stages of severity. We have simple cases, we have light cases, we have moderate cases, and we have severe cases. And the people that has depression today in one level, during the time, frequently, the severity is growing forward, and the risk of life coming together of these different occasions and steps of one patient and all the patient with depression disease. The bipolar, we name it this because frequently we have some alternation with moments of anxiety and euphoria, but this is a small number of cases. The next one, please. Here, a comparison of the data. This is only to put in evidence the idea that in yellow bars, we have women with depression, and in orange bars, we have the men. So independently of the time in life, the age of the people during different decades, we have a different presentation between both genders, and always the woman, the girls will have some kind of maybe spiritual or hormone predisposition to be sick in terms of depression. This is a reality around the world. Please, the next, Thiesen. So, trying to consider, we are dealing now with an epidemic of mental illness in general aspects, all of the diagnoses in psychiatry. I put there, this is a medical idea. The incidence and prevalence of mental illness is increasing worldwide as like cancer, the same, and many other medical problems. And its causes are not yet clearly established, despite recent advances in modern psychiatry. Go, please. So in terms of common mental diseases, the most common, depression, the first one, in terms of statistic around the world. Anxiety, let me tell you that Brazil is the country comparing to all of the other with the higher number of cases of anxiety problems in terms of a medical and psychiatry point of view. This is one expression of the Brazilian mental problems and in those days. Schizophrenia, bipolar disorder, eating disorders as anorexia nervosa and bulimia, childhood behavior disorders. Here, we put in evidence the idea of autism. This is a very important matter to consider in terms of medical aspects, but importantly too, in terms of spiritual problems. We need to recognize this is a very new psychiatry problem in terms of epidemic numbers too. The next, please, Stephen. Here, this is a very interesting paper from the Lancet, the best medical magazine in Europe, from United Kingdom. So in a very nice article, we can see the distribution of the different medical psychiatry problems in the different regions from the whole geography of the world. And we can see in blue, or maybe for you green, but for me in blue, depression as the large segment because of the number of cases. In red, we can see the anxiety problems, but around our world in the same way. But depression, our issue, this is the more important in terms of the number of cases around the world. Next, please, Stephen. Here, this is one curve that put in evidence autism in the last decades. For example, we have now one case of a child with autism when we compare with 69 child coming now from this to this world in a healthy situation. And 20 years ago, we had one case of autism to comparing with 15,000 children with normal health. And we can see the curve, the growing number of cases, the growing number of papers trying to understand autism. And I suggest that in another time, another date, we can share some aspect very interesting to us. This is another problem. Here, again, in the Lancet about depression, can you see a mountain? This blue mountain is depression in different stages of life, decades of life. So we have some kind of plateau during the 40s to 60s, but we have people with 10, 15, 20 years old, and we have people with 80 years old committing suicide because of depression. We are observing these numbers because we need to study as common people, as health professionals, as spiritists. We need to understand this very strong problem in humanity. The next, please. Here, the gender too. In the right, woman. In left, man. We have some kind of symmetric presentation between genders. But again, we can see one higher number of cases in women. The next, please. Here, another paper from the same magazine, The Lancet, no health without mental health. This is the idea that I tell you before, that when we have a patient with depression, but with very different diagnoses in psychiatry, we have the same. We have the people with different difficulties to care him or her, themselves. So when we care after a good and a correct diagnosis of mental disable, we can help the people to care their different medical problems, including hypertension, diabetes, rheumatologic problems, neurologic different problems, drug addiction as alcoholism, and many other different problems in our reality. The next one, please. Here, I put trying to remember some very nice people, all of them with depression. Robin Williams, that commits suicide. Santos Dumont, Abraham Lincoln, Winston Churchill, William James, a psychologist from the United States of America, a very nice spirit today, sending to us very nice automatic writing messages to our instruction in this method. Tennessee Williams, Vincent van Gogh, and if we have time, I would like to share with you about some experiences with this different personalities of the human history. All of them depressive people, and some of them committed suicide. Robin Williams and Santos Dumont, for example, that are very nice people, and I have some spiritual aspect of their histories. If we enter Wikipedia, we can know about many famous people, including from arts, from science, from philosophy, some religious environment, all of them with depression, and we can know about by the first letter in terms of the names. We can observe the very spreading problem in humankind in those days. Please, the next, Stephen. The same, continuing. We have many pages, many different pages, because we have many and many people disabled because of depression. Now, we have many thousands of evolution in medicine in the history of humanity. But we are changing. I will show you some aspect of that. We have the next, Stephen, the materialistic paradigm of psychiatry. We have nowadays a pharmacological approach. For example, this problem of depression, what that my colleagues can do after a very good diagnosis of depression, independently of if light, intermediate, moderate, or severe cases. Only we can do because we are blind in the causes of the depression in global terms. So we prescribe antidepressive drugs. We have a very clear benefit because these drugs, they will help the neurotransmitters in the brain. But this is a consequence of spiritual problems, psychological problems, but frequently past lives problems. And we need to change the view of the medicine to incorporate, and we are doing this, incorporate the spiritist ideas about reality, and in this aspect too. So the pharmacological approach, because of the brain neurochemistry, because of the lack of many of the neurotransmitters in the depressive people brain. But the treatment is insatisfactory results because they are dealing with the effects. We are doing some kind of suppression of the clinical manifestations, signs and symptoms of depression, depressive disease. So we need to change. Now we have the way to do that. We can understand the mechanism. So we need to look for one spiritual paradigm, one different model to understand all the mental diseases, but depression in this moment, because this is the more spread problems in certain terms of psychiatry. The next one, please. Here the idea where the common doctors, they understand that all the medical, clinical and mental problems are only related to the unique aspect that we can detect by resonance, by tomography, by ultrasound, by PET scan, the physical body. But as spiritualists, or specifically spiritists, we understand that we have a soul, that we have a spirit. We don't have, we are spirits, we are souls, we have bodies, and we have the perispirit, as we can see in the screen, between physical body and one idea of a soul or a spirit. The next one, please. Spiritual paradigm of psychiatry. Every mental illness is a disease of the spirit, and the spirit must be treated. We are spiritual beings living a human experience, and not the opposite. The next, please. Here, the idea of neurons connection. We need the neurotransmitters in the neurophysiology, neuropharmacology, neuroanatomy, neurohistology. We need to understand the connections between all of the neurons to a good neurologic function, but not only neurologic, but psychiatry, physiology too. The next one, please. Here, the idea of the connection and many different molecules that are doing a very complex situation in the difference between the different neurons in the brain, in our brain, and all of the brains in terms of animals too. The next, please. The same, here we can see dopamine, serotonin. We can see, for example, oxytocin. We have many different dopamine, and they are important to the neurophysiology. The same. The next, please. In terms of depression, the World Health Organization, this is one idea to the spirit center too, in our common work, in the street, in the buses and the metro, and in the spirit society too, in family, because we need to stay trying to detect the first symptoms that we can correlate with a diagnosis of depression. And we need to refer the patient to a family doctor, to a general clinician, or, for example, a psychiatry too. Next one, the idea of conversation, and to hear, to be, to trying to care of the idea of we need to detect as soon as possible the first symptoms of depression. So severe depression is a disabled medical condition that affects the patient overall health, family, work, school life, sleep, and eating, and libido. In the US, some percent of people with severe depression commit suicide, and up to 60% of people who committed suicide had severe depression or other mood disorder. We have a very clear relationship between those big problems in mental health. The next, please. Here we can see the one recent map in terms of depression around the world. In Africa, we can see in yellow, but we have not statistic. You can see some countries in Europe. We can see India, Brazil, in South America, and we can see United States of America, including Alaska too. This is a very worldwide problem. The next. Here, the idea of suicide in all of the countries. We have some severe or very important number of cases in Russia, for example, in India, in some African countries, but we can see Uruguay, for example, we can see Guyana, and we can see Canada and the United States of America, Australia, New Zealand. In Japan, for example, many suicide cases because of depression. Can you see the idea that independently of the economics condition, for example, Japan, we can see a very high number of cases too. Let's go, please, Stephen. Let's go. Why people have been so depressed. Next. What are the causes? The idea is spiritual reality of humankind. The next, please. Please. Spiritual obsession, negative influence, and persecution by spiritual entities, spirits, discarnated one, that have been victims in the past. Another aspect, guilt. They do not remember their harmful acts from other lives, but carry the feeling of guilt in their memory, spiritual memory and spirits. The next, please. The severe spiritual influence in these cases, along with the feeling of guilt, causes damage to the perispirit or spiritual body, which will result in central nervous system changes and other issues in the physical body. So we can understand one different paradigm, the action of the discarnate people in the people, in the brain, in the mind, that people that are living without the understanding of the causes and the reality of that influences. This is a common and different way to understand the not only in depressive cases, but in terms of mental diseases and all the diagnoses in psychiatry. Disease of the body or disease or the spirit. We have changes in the body, but this is a spiritual or one soul problem. We have to understand the contribution of spiritism. I will talk to you about this, and the spiritists to understand this reality, depression and the relationship with suicide, spiritist, spiritual society, resources in treatment of depression, and we need to care about, to talk about and to study how prevent suicide. Because in medicine, in all specialties, we need to know better about each one problem to try to do the prevention of new cases in all the different diagnoses in medicine. The next one, please. Here, Spiritism, the 5 main books. The next, please. In Brazil, we have more than 15,000 spirit centers or groups. This slide, I show it in psychiatry congress in different cities and different countries. So I need to present to my colleagues that, because they don't know about spiritism, some very simple aspect to them. For example, we need to put in evidence the idea that the work in the spirit society, this is a philanthropic and a non-profit institutions to study spiritism and to help suffering people, as you know, in Dublin. The next, please. Next. We share with my colleagues about immortality, reincarnation, mediumship, influence of the spirits, dead or discarnate people in our lives, the value of prayer. Today, we are studying in the university, in faculties of medicine, the value of empathy, gratitude, meditation, prayer in the bedside with my patients. And we are studying the relationship of religiosity, spirituality, and cardiology and psychiatry. This is the new paradigm that are growing in terms of the world to understand in a different fashion all of the medical problems. The value of prayer, the existence of the spiritual world with billions of human spirits around us, communicability of the spirits, psychophony, automatic writing, clairvoyance, planet of tests and atonements, hospital planet. We need to share the postulates of the spiritism with the people to a better understanding of this problem. And the idea of the inner enlightenment as one objective to the future from this present to all of us. Let's go. We are working with a team of doctors that are mediums with different medical specializations for decades. those or these doctors and other mediums can see the spirits. When we open a case of one patient that tried to commit suicide 2 or 3 times, we open the case. What is this? We have the name, the address, we have some medical observations of that case, and we want to care that case in that moment of the mediumship meeting. So we will open and we will see the past. We will see the spiritual environment of that patient. So in the past lives, and we can take care of all of the spirits that are linked to that case. We take care of the patients with depression at distance. For example, we have a patient in Buenos Aires, Argentina, or we can have a patient in Auckland, New Zealand, or in New York, or in São Paulo. Only what we need is the information about the case. And so we will open that case to help and to care of them. They are referred to us by the psychiatry because they know this job, this work in the Spirit Society, clinicians and family doctors. The next. Let me show you. Just 1 year ago, in August, we are arriving in Lisbon to the higher forum of psychiatry in this world. We have meetings every year, and this is the poster that I could present to my colleagues. In that Congress, we have 6,000 specialists in mental health and psychiatry, psychologists, psychotherapists, psychiatrists, and from every country around the world. The next, please. The next. Here, another meeting in the last December, one meeting of spirituality and psychiatry promoted by the World Psychiatry Association. And I did the same. I sent the abstract, and the scientific committee, they accept that I could share with them talking about spirituality and mental diseases. Please, the next. Here we can see my oral presentation about autism in the Congress in Jerusalem in December between spirituality and psychiatry. The influence of the spirits in autism spectrum disorder patients and the benefits of the fraternal dialogue. And I put the expression psychotherapeutic approach to the spirits by the mediums around me in the mediumship meeting to care of those patients with autism disease or medical problem. The next, please. Here, one may be very interesting. This is the folder of 12 December last year. And I visit the United Nations, invited to talk about this issue, depression and suicide, but with a medicine and spiritual view to all the people that was in that moment invited to the United Nations in the center of New York. The next one, please. This is the first slide of that presentation. Very similar here. The next, please. The idea of when I was arriving in the United Nations, the next. The forum, the next. Resources for spiritual treatment, disobsession, magnetic treatment, fluid therapy, mediumship. Here, here the idea of magnetic healing, mediumship as a healing tool for the soul. The next. Here, one photograph of the spiritist magnetic healing in Rio de Janeiro. The next one. Here in the Astral City, the same. Next. André Luiz with the Clarencio carrying him because of the recent discarnation, as we can see in the book. The next. Teilhard de Chardin. We are not human beings, have an occasion spiritual experience. Next. We are essentially spiritual beings having a human experience. This is completely different. The next. We have one worldwide epidemic, consequences of humanity's spiritual imperfections because of predominance of materialism. Next. Semi-primitive world, our planet is a hospital. We need to consider this. Sick spirits, moral imperfections, selfishness, pride, vanity, excessive passions, violence, and cruelty. Next. Every major disease has a spiritual cause. Psychological problems. We have simple or complex obsessions. We have frequently some organic causes as hypothyroidism. The next, please. Depression is a disease of the spirit, and in the spirit, it must be treated. The next. We have some different psychological aspects that we analyze case by case. Existential void, loneliness, frustration and dissatisfaction, loss of loved ones, guilt feelings, resentment, childhood conflicts and trauma, materialism and inner void, sexual conflict, obsession, and many things. I think that we need to finish this part of the talk because I would like to hear about you in terms of answers and questions, but difficulties in dealing with the trials and expiations that are part of our present spiritual condition. Through our mistakes and transgressions of divine laws, we create the reality in which we find ourselves. We reap what we sow. The next one, but Stephen, I am in your consideration to ask all of the questions of our colleagues and friends. About the spiritual reality, the spiritual reality on the earth has life of all kinds. There are millions of sick individuals in the spiritual world, sick of the spiritual body or mentally ill. Depressed, who died by suicide or not. We have depressive people around us or in the big spiritual realm on the earth, because in both sides of life we have a planet hospital. Stephen, my friend.
Okay. Wow. Well, it's a lot of content to be discussed and shared. So thank you very much for your input here. And we do have our first question here. Sometimes we don't, it's from Daniela Paixão. Sometimes we don't pay attention to anxiety symptoms. How to handle anxiety according to spiritual approach, especially nowadays where we are surrounded by uncertainty.
Daniela, thank you for your question. We have a very big diversity in the people in both sides of life. So we need to pay attention case by case. We would like to help the people, but to help, we need to know about the feelings and the individual situation of each one. So we need to do some kind of interview to understand the personal, the individual problem in these days of that life, of that people. So we have different anxiety levels of severity. So frequently, if the people has some religion, some linking with some kind of church, from different religions around the world, we can suggest his or her presence in the meetings in the church. Because when we have one idea of spirituality, independently of the church or the religions, the people will pray, and the prayer, independently of many other aspects, we have some benefit very clear to the people. If the people know about spiritism and the people have one spiritist center to visit, they will hear about one lecture in terms of spirituality or spiritual understanding of life. We have the passes, we have the water to be magnetized and use it to a preventive in terms of anxiety to be more severe during the next month or years. But we have people that need psychotherapy, a psychological approach, a medical approach. So we always recommend, when we have some doubt, what to do when I share with our colleagues or friends or family people in terms of anxiety. We should suggest one visit, for example, to a family doctor, to a medical clinician doctor, or one colleague in terms of mental health area. So we need to be sensible to the suffering manifestation of each one, because we have different stages of anxiety. And in some cases, we will need to use the anti-anxiety drugs. But always, when we can, we should offer one spiritual, one religious approach to, not only, but to, with one medical visit, one idea of to ask for help, because we can find one people with a very severe case of anxiety. So we need to use drugs. Thank you.
Great, thank you. And here is not a question, it's more a comment from Elaine Coutinho. Thanks so much, Dr. Sergio. Regarding to my grandson's no autism, I am always learning from you. And regarding to all diseases, we are always aware of the value of spiritual treatments. Thank you. Now it's a question from Rumi Millard from the United States. Have you noticed that medical community is becoming open to the spiritual relationship with depression?
Yeah, but we thank you, my friend. I think my friend are in California now, but I would like to tell you that we have billions and billions of people in both sides of life, but we need to understand that we have 6,000 years of the humankind history in writing papers and books. And this is the same time of the medicine history, from Imhotep in ancient Egypt from now. The first doctor of humanity, Imhotep, near the pharaoh in a very nice dynasty. So spiritism, bringing, offering light to the medicine too, but to all of the human expressions in life and science and philosophy and many other things. This is a new one. So we are doing this job with different colleagues in Brazil, in different provinces here in Brazil, and some colleagues in the United States of America, in Europe, in Australia, trying to present the nice relationship in terms of spirituality and all the mental diseases. For example, I am working in this field from the next 4 decades. So we are dealing with people and suffering patients with mental diseases with different diagnoses, including the spreading around the world of the depression. So I am trying to visit during the last 12 years. The first time it was the World Congress of Psychotherapy in Beijing, China, in 1998, in 2008. So we are dealing with seeds. Do you understand? Seeds of this knowledge. Seeds of the frontier between spirituality, spiritism, and mental disorders. So we need to share, we need to study, we need to do good papers with scientific methodology to be accepted by our colleagues, because they are scientists too. And we need to do a very nice approach to try to prove the relationship between spirits and mental disorders. And I am visiting. I am doing the best that I can, but we have a very long way or journey to the future because we are a lot of people. Do you understand? We need to work and have and ask for help to go to different countries, to find our colleagues and to share this idea that comes from Spiritism, from Allan Kardec. All of the merit of this understanding of this approach comes from Spiritism, from the main books, from the Revue Spirit, because we have good spirits writing in those days, 1 century and a half in the past, about mental disease too, about the influence of the spirits in the mind, the human mind, and including in human mind pathology. Thank you, my friend.
And do you think a lot of people are mistaken about, oh, I have an anxiety, I need to be treated. I have this. So people is self-medicate them. They go to the internet, because now it's easy. People go to the internet. Oh, I have this. And they do a self-treatment, and these generate this got the worsen the case.
Well, this is a common medical problem, not only in terms of mental diseases, but in Brazil, for example, we cannot take medicines of psychiatry or psychic action or brain action without a medical prescription. The people cannot go to the internet and buy medicines because we have laws that protect this problem. Because, for example, many people can use 20, 40 comprimidos, pills, thank you, and commit suicide because we are dealing with a very important medication. So in Brazil, only by a regular, very observed by the pharmacist in internet, because we can share the prescription, or going to the pharmacy to buy the drugs. In Brazil, we can see this. For example, we have doctors with depression trying to commit suicide, but because they are doctors, they are free to prescribe for themselves. This is a big problem. And suicide with my colleagues. For example, anesthesiologists, do you understand? They have access in the hospital with one drug to put in the vein, and they die immediately. Wow. So I don't know in terms of the other countries, but we do not recommend. We understand that this is a very bad problem. And we have people that are buying different drugs with different actions to other objectives in their lives. And frequently we have collateral effects from those drugs. And many of them may be mind collateral effects, bad effects. So this is a problem. Internet is very nice in some fashions, but we can buy problems, and we can share death attitudes between different people and groups in the internet.
And we are walking toward the end because it's about like 1 hour and a half. We were talking here. You were talking. So, okay, we talk about the symptoms, treatments, and how to recognize. And what is your recommendation to avoid it? How we need to be with ourselves in order to avoid this?
If you are trying to ask about avoid depression, we need to understand that we have some problems step by step. Nobody will be depressive in 1 week. This is some aspect of construction, because from the childhood, adolescent, many frequently we have very youth people with depression. And depression we can find in every decade of life. So, for example, it is true that when we have a divorce, or when we have one death in a very intimate and close relationship, when in a couple, one goes and the other stay here. This is very common around the world, always. So this is one very delicate situation, because many people will experiment a very intensive suffering. And this is one challenge to that people that stay in the life to stay well, to react in a good way, preserving the mental health. And we need to valorize the relationship in terms of family, friends. We need to valorize the medical approach to that people that are suffering or presenting the first symptoms of the possibility of depression. And the people should ask for help, because the light depression in those days will be moderate and will be severe in the future. As soon as we are understanding the idea to take care and to ask for help, this is a good way. But we need to consider too that the religion is a very interesting help to the people. We have some cases of bad influence from one kind of religion and some aspect that we can understand a bad relationship with the life. But commonly, in news from abstract and research in the frontier between medicine and spirituality, the number, look for this, the number of times during the week that the people are in the church, independently of Catholic or Protestant or independently, maybe in the Tibet, in Buddhism, maybe in the mosque, in Islamism, independently of the kind of religion. If I go one time a week, I have one kind of protection. If I go there 2 times, we have one very nice, better protection to prevent and to have one better response of the medical psychiatry treatment of the depression. So, for example, Stephen, I am a cardiologist, but what I am dealing now, independently of internal medicine and cardiologists, patients, I am dealing with mental people from autism in the childhood to the depression in different decades of life. I am coming to be a psychiatrist because I am studying this area now, because I have many people asking for help. So we understand that if I go to the church 3 times, I am cooperating with my treatment, independently of the... So, 2 different specialties in medicine. This is very clear in the literature in medicine: cardiology and psychiatry. When we link religiosity, spirituality, and medicine, we can see the best results in 2 different specialties that are very important to the humankind. The diseases that are the more frequently cause of death in this humanity are the cardiovascular disease. So when we link coronary heart disease problems and spirituality, we are saving lives. When I pray with my patients in the bedside, I am helping my patients, because the prayer changed the brain because of neurotransmitters in different areas of the brain. The same in psychiatry. Do you remember I showed you the idea of a big meeting only to link spirituality and psychiatry? This is the last acquisition in medicine as a human science to benefit the people in terms of prevention and in terms of therapy.
Wow. So everything has a trigger. We need to identify the trigger. And at the same time, we need to look ourselves in order to keeping our prayers, staying tuned. That doesn't matter which religion you are, the creed, the faith. You just need to be in tune with high level spirituality.
I don't understand exactly your question.
No, I'm just saying.
A comment.
It's not a question. It's more
A
saying
comment.
we need to keep ourselves more in
Yeah.
tune
Yeah.
with the higher spheres.
Stephen, we need to understand in terms of humanity that we can do sports. We should have our friends and to visit the different countries in terms of tourism. We need to share with our children inside our home. We have many nice things to do, but we need to understand this new step in the comprehension of the human mind, in terms of that we are spirits, we are souls. We need to change our understanding about reality. So we need to share with the spiritual world around us in a good fashion. We need to go to our inner understanding about ourselves. We need to care, but not with drugs, not with alcohol, not with only medicines, and many different associations of the human being in terms of life with things that cause harm to ourselves. We need to choose what is fine, what is something that help me to live my life in a very nice stage and comfort, and with the idea from the spiritist books in terms to know about ourselves and what we are living in the future if I do the best choosing during my life, during all my lives. And we are understanding this now and the relationship of our spirituality and our health. For example, gratitude. If I can recommend, based in medical scientific work, that when I am I have gratitude with common situation during the day. If when I go sleep, I put in a paper 3 aspects from that day that I understand that I should be grateful to people, to institutions, to Jesus, to God, my brain change. We have some colors, we have some enlightenment physically in terms of the brain. If we have this in the brain, we have the same or better in my soul.
Yeah. Correct.
In my very spirit.
Good advice. Okay, Dr. Sergio, we are running out of time. We are over. But I would like to ask you to join us in a second talk, or a second live, to keep going this topic, because we have receiving here a lot of not a lot of questions, but a lot of comments to come back. So I ask you to come back another day. We will find out a better day that suits you.
Stephen, okay? It's a pleasure to me. I have a dream.
Oh yeah.
To share with you presentially. I don't know in the future, post pandemia.
Yeah.
To visit Dublin again. I don't remember 1, 2, or 3 times in the past.
Yeah, you came two times you came here.
2 times.
The last one was 2 years ago.
Okay.
Yeah.
Thank you, my friend. Thank you
my
to
friend.
all of you.
I like to say, because Dr. Sergio, he has a prayer for humankind every day at 9 o'clock Irish time. So it's about 20 minutes to start.
Yeah.
So if you want to join, and would you mind to do our final prayer?
Me?
Yeah,
Yeah.
I like our prayers.
Yeah. Thank you, Stephen. I would like to share with you in this very nice moment, in this simple study between medicine and mental disorders. And we thank to God, and especially to Jesus, and to all the good spirits around us, or the spirits related to us and our lives, because they are together with us. They know about our spiritual problems and necessities, and they are very loved ones, and we would like to thank all of them in this moment. We would like to be together again in the future. Jesus, we would like to ask to all of the humanity with many and many disabled and medical and social problems. And I would like, and I know everybody would like to thank to everyone for this moment. Thank you, and God bless you, and we'll share again in some month in the future, or weeks maybe. Thank you, Stephen. Thank you so much for this opportunity.
Thank our friends in the United States, in Ireland, in Brazil, in Italy, in Spain. So thank you very much. Have a nice day. And Dr. Sergio, our warmest hugs for you. And I'll see you again shortly. Thank you.
Thank you, Stephen. Thank you. Bye-bye.